The weight of a body is the force of gravity acting on it. One extreme of weight is obesity, and the other one is a lean body. Both are affecting the quality of human life. Greetings everyone, a very warm welcome to sqadia.com. Today in this video, we are going to hunt details of unintentional weight loss. So let's see what it is. Unintentional means involuntary or unintended. It is basically loss of at least 5% of usual body weight over 6 to 12 months. It is common and more likely to affect elderly patients up to 8%. Weight loss is a non-specific symptom which might result due to a gastrointestinal condition, systemic pathology, behavioural or psychiatric problems. This weight loss ultimately leads to increased morbidity and mortality. Mortality or death is due to some underlying disease process. Well, people usually confuse the terms weight loss and cachexia. So let's see the difference between them. Unintentional weight loss is 5% loss of body weight in 6 to 12 months, as we have discussed before. While cachexia is a wasting syndrome with 3 prominent features. First is unintentional weight loss. Second is skeletal muscle wasting. And third is anorexia. So now we know that weight loss is one of the features of cachexia. Now, if you want to grab more details, stay tuned and keep watching sqadia.com.